F just joined us. I mean, there's been mixed reaction to the passing of the National Health Insurance Bill. The National Assembly giving the bill a thumbs up despite an outcry by health professionals. The contentious bill still has to be considered by the National Council of Provinces. For more insight, we are joined by dear MP Michéle Clarke. And could the NHI, Michéle, be just an accident waiting to happen?
Absolutely. Firstly, good morning to your listeners and thank you for having me on your show. There's just so many pitfalls within this NHI bill that that the DA can't see that this bill could be implemented at this stage in this country. I mean, number one, there's been absolutely no feasibility study ever presented to the committee, even after repeated requests at every meeting. No financial model has been given to us in terms of this bill. National Treasury has not presented to the Committee of Health how they intend in financing this bill. And in the budget speech of the finance minister, he didn't even mention this bill. So and the consequences thereof. And so, you know, where are we actually going to find the billions of rands that need to be spent in order to fix our hospital infrastructure, number one, before we can even think of supplying quality health care to the citizens of this country?
And of course, Michéle, when we talk about the cost of it all, it is at face value a good concept. It's a good idea to try and give citizens access to good health. But the cost of it is going to cost a lot more. And we're not even talking about execution, because I imagine we're still a long way away from it being actually implemented in real time on the ground where people are accessing it.
Yes, look, the cost is a major problem, but it's also all about the will of governance and to have a competent government in order to ensure that this bill is run properly, and when this bill is put in place, that we actually get the outcomes we should get from this bill as it says in this bill. So firstly, you know, the OHSC has to do a investigation on each and every hospital to see if they comply to the regulations in terms of this bill. And about 65 to 70% of hospitals in this country don't comply to the ideal clinics regulations. The only hospitals at this stage that do comply are in the Western Cape. Then, in terms of the timeframes, we're already 5 years behind the timeframes that originally was stipulated within the bill. And if you look at SAMA, the South African Medical Association, they're completely against the bill as well. They do not support it. The independent parliamentary legal advisors that came to our committee to present mentioned an array of unconstitutional issues around this bill, which was totally ignored. And, you know, all the input we gave, and that for all the other opposition parties as well as stakeholders that presented to the committee, was never taken into account. So, you know, not listen to any advice that was given to them in terms of this bill. Now, if you take the 9 million people that are currently on medical aid, and you then make sure you then ensure that they now form part of patients of the state hospital care, you can just imagine the kind of burden that is going to be put onto the hospitals additionally. And you know, we believe that if there was a blended approach in terms of medical services in this country, where we form partnerships with the private sector in order to make sure that we have quality universal health care, because please understand, the DA is not against quality universal health care in this country. That's really what we want. And if you look at our hospitals in the Western Cape, they are far superior than the rest of the country. And we want every citizen to have that. But there are so many issues to before we can even any of the stipulations that are within this bill.
And obviously, Michéle, would this then spell the withering away, if you will, of the medical aid scheme as it is structured in present day in South Africa? You've just mentioned the 9 million people who are currently insured, who will not necessarily get reimbursed by NHI if it's implemented the right way and it's come to, if it's executed and it's come to pass.
Yes, well, the next issue is that they have never told us what services the NHI will be offering and what top-up you would need from a medical aid in order to supplement your medical care. So that's a huge glaring issue because we still don't know what services are going to be offered in terms of the NHI bill because it's never been discussed, even after all these requests. Then you have the referral pathways where you have to register online as a patient. Now, I can assure you, I do lots of oversight visits on the ground, so I can tell you I've been there. I see what happens. I'm in hospitals almost every week. And most of our hospitals in this country don't even have an online system in order to register patients. So, and that is why we sit with huge medico-legal claims, because we simply can't find patient files when there are when there's litigation instituted against state hospital care, because the patient records are in such disarray. You find patients' records stuck in boxes all over the place in wards and in offices, and just cannot work in that kind of environment. So what would happen too is that that the provinces have huge accruals because they do not pay their suppliers within 30 days, and then of course they're not supplied drugs, food, etc. And they have huge medical legal claims. So those accruals and medical legal claims are then deducted off their annual budget, and they're very often left with less than 50% of their budget, which they then have to use as their operational costs. And therefore we see over 168,000 backlog in surgeries in our hospitals at this stage.
That's DA Member of Parliament Michéle Clarke. Thank you.